Okay, so here I'm introducing myself as a student physical therapist assistant. I'm also making sure that Hector is the right patient, so I ask for his first and last name and then his birthday. And last but not least, I ask if he's feeling any pain today, and he points to his left arm. He rated it as a 5 out of 10 on the numeric pain scale. So I went straight into it. I started with the gross strength test of his elbow flexion, since he was already in a seated position. I started with his shoulders neutral and his elbow flex, and I applied pressure at the distal forearm, trying to push his arm into elbow extension. Moving on, I grabbed my goniometer to test the range of motion of Hector's elbow flexion. So I started with my fulcrum at his lateral epicondyle. My stationary arm was at his lateral midline of the humerus, and my movable arm was at the lateral midline of the radius. I had him lying in supine with his shoulder 0 degrees flexed, 0 degrees extensed, and 0 degrees abducted. After having him perform the movement passively, I then measured his range of motion, which he tested at a 135 degrees, which is within the normal range of 0 to 150. Anything greater than 135 is functional. Now I'll be doing a manual muscle test on the pronator quadratus. Since he was already laying in supine, I just skipped to this manual muscle test. So I'll have his arm against his side with his elbow maximally flexed and his forearm pronated. I'll be applying pressure at his distal forearm into supination, with my free hand supporting the distal humerus against his side. So after performing the manual muscle test, Hector rated a 5 out of 5 on the manual muscle testing grade. Next, I'll be testing the muscle length of his triceps. You could do this in either supine or seated, but I chose to do it in a seated position. So I'll be testing the full flexion of the shoulder followed by the full flexion of the elbow. I use my goni to measure the elbow flexion. Normal findings is just normal elbow flexion, range of motion, which is 0 to 150 degrees, and he measured at about 135 degrees, which matches with my measurement of his elbow flexion in supine. Next, I'll be doing a manual muscle test on his biceps brachii. I kept him in a seated position, and I had his elbow flexed to about 70 to 90 degrees with his forearm fully supinated. I then applied pressure at the distal forearm into elbow extension. My free hand was stabilizing his ipsilateral shoulder. I showed him the passive range of motion before having him perform the active, and it seems like he rated a 5 out of 5 on the manual muscle testing grade. Lastly, I'll be doing a special test testing Hector's median nerve. So with him standing, I have him positioned with his contralateral cervical side bending and his ipsilateral shoulder depressed. I'll have him extend his arm in a plane of scapula with his elbow extended, forearm supinated, and wrists and fingers also extended. So this tests his median nerve, and he'll notify me if he feels any pain or paresthesia.